We are working with you to stay healthy. We really try to promote that proactive health care. I preach a lot about opportunity and achieving success. I preach a lot about opportunity and achieving success because I work with so many people who don't have any success in their life and don't have any hope. And I think Rockford is a place of opportunity where you can do that. But a lot of people, they've been told they are a certain way, and so they don't realize they have the ability to change and move forward.
We will provide opportunities for families, for seniors, for disabled residents in our city that really give them a quality place to call home, but a quality neighborhood to come home to, and ultimately an opportunity to truly improve the quality of their lives.
We know that there's a thing called the tyranny of the zip code. We know that people who are born in a certain zip code will have less healthy outcomes. There is some belief that you can actually predict a person's health and longevity and educational achievement by simply looking at the zip code in which they were born. We have to do more to advance the health of places. We have to do more to help people access health care.
One of the things we promote at Crusader is, hey, if you have an illness, if you have a condition, we want to get you to be proactive and take care of that before it gets to the point of you being sick. Unfortunately, too many people look at the emergency room as an answer to health care, when really what they need is primary care, where we are working with you to stay healthy, not just addressing an accident or you getting very, very sick. We really try to promote that proactive health care. You know, for myself, because I spent so many years working in the HIV/AIDS program, that became really a crucial component for me. Because for the folks I deal with, it truly is a life or death situation. If you don't get your health care under control, taking your medication, seeing your doctor, and doing all those things, you can have tragic consequences.
Our seniors aren't able to afford their medication. And so what they're turning to is other drugs that help ease the pain that they have, and many of them experience great pain because they don't, or didn't, I should say, have access to adequate health care. So may we be working with an addiction issue? May we be working with a mental health or depression issue? May we be working with a physical illness? Or may we be working with somebody who just lost a job, lost a house, came to us from what was a stable life? It's those and more.
We work with the Rockford Housing Authority residents at various levels. It depends on what the site is and what type of an intervention they need. One of the things we do with the family units is make sure that they are aware of our pediatric services, and make sure that they're getting their kids to the school physicals they need and the other things they need to move forward. For a lot of our disabled patients who might live in the high-rises, we actually do home visits to some degrees. I have case managers and nurses who will go and visit, assist with people getting their medications, assist with making appointments, and helping hook up transportation. You know, we find with a lot of folks that once they get started in housing, they still need a lot of other services. And sometimes you need to, once again, reach out to them and let them know that these services are available. I like the fact that the Housing Authority is at least trying to help people realize you can move forward. I think that they really want to improve the city. They're not trying to warehouse people. They're not trying to, put the bad people in one area to keep them away from the good people. They're trying to integrate and build a community, and I think that's an important thing. There is some stigma involved with being in public housing, in being a Medicaid recipient, and even coming to Crusader. And people, even though they may be in that situation, that can affect how they view themselves. One of the things that we try to do is make sure that they feel respected. Make sure that we provide access to people to deal with their health care. Make sure that they realize that our goal is to help you move forward in life.